Well, hello everybody. I'm Dr. Anderson. I'm a physician here in Lubbock, and I wanted to say thank you to Diane, especially for inviting me, and thank you for having me speak today as a guest at the Cultural Awareness Seminar. And today's topic is an important one to the Latino Hispanic community. It's also an important topic to people of different races and different cultures. And it's we're going to talk about curing diabetes, how to end an epidemic that is in the Latino and Hispanic community. I usually start with a disclosure. I manage this one-man company. It's just me, but it has a big name, Cut the Killer Carbs International. And the point of this company is to end the epidemics of diabetes and obesity that we have in West Texas today. My website is metaboliccoaching.net. And if you want to learn more or learn about the course that I teach, then that's where you can go, and that's where you can send your friends and family to go and learn more about this. So when we start talking about diabetes, during this presentation I'm going to refer to type 2 diabetes. When I say the word diabetes, I mean type 2 diabetes. Type 1 is a totally different disease, it's a different animal. But the first place we would look if we're thinking about diabetes, we look at the American Diabetes Association website. And on that website, it says that type 2 diabetes is a progressive and a chronic condition. That's a quote from the website. And progressive means that the disease progressively gets worse. It gets worse over time. The longer you have it, the worse it gets. And chronic means you'll have it long term. It's a disease you'll have for a lifetime. So it sounds like a pretty bad diagnosis once you're diagnosed with diabetes. Who in the audience either has diabetes or has a family member with diabetes that you guys know? Well, we'll go over the statistics. It's very common. Also, according to the American Diabetes Association website, it's 19 to 20 million Americans that have diabetes, and it's the leading cause of kidney failure, lower limb amputations, and new cases of blindness among adults, and accounts for $245 billion in healthcare spending. That's $250 billion to take care of type 2 diabetes. Closer to home in Texas, back in 1991, about 6% of Texans had diabetes, but as of 2010, and this is the latest data I have from the state, 2010, it was about 10%, so diabetes is on the rise. That's the epidemic on the rise. And in the Latino Hispanic community, it's worse. You know? Here's the Latino Hispanic community, 2010, 11% had diabetes, and compare that to only 8.2% in the white population. So that shows that there's a high proportion of the white population that also has type 2 diabetes, and this is a trend nationwide. This is the whole country. It's not just Texas.
And we do have the Texas and the U.S. stats that might shed some light for him.
Oh yes, yeah, thank you. So throughout the entire United States, it's gone from 8.8% to 9.3% from 2008 to 2010.
And Texas is higher than average.
And Texas is higher than the national average. That's exactly right.
We're bigger and better.
The hospitalization rate is higher for the Latino and Hispanic community than it is for the white community. It's about 16 versus close to 15. But that's not the worst part. The worst part is the mortality rate. So the mortality rate is the death rate from a disease. And the death rate for type 2 diabetes is twice as high in the Latino Hispanic community. It's 32 versus the white community at 16. So there's twice as many deaths each year from type 2 diabetes in Texas in the Latino Hispanic community than there is just in the white community. And if that wasn't bad enough, there's another 4.3% of the Latino Hispanic community that are pre-diabetic. And pre-diabetic means that they're on their way to developing diabetes, and they'll probably develop it in the next few years. And you know we're talking about a significant proportion of the population. This important population, 38% of the population of Texas is Hispanic, which is 9.4 million people. And that 15% of those are diabetic or pre-diabetic, which is over 1.4 million people. So it's a problem. It's a big problem for the state, and it's a big problem for your community, and it's a problem for your family. Because you know these people. These are your family members and your friends. Exactly what is type 2 diabetes? I'm going to define type 2 diabetes very simply as insulin resistance. Okay? And I'm going to go through this step by step by step to see how diabetes is caused by insulin. Diabetes is insulin resistance and what you can do about it. Normal human metabolism works like this. When you eat a carbohydrate, foods that are carbohydrates, your blood sugar goes up. And in response to the blood sugar going up, the pancreas makes insulin, and your cells respond to that insulin by storing away your blood sugar. They store most of it actually as fat. They store some of it as sugar. And when they store away the blood sugar goes back down, you get hungry, so you eat again. And this is like normal human metabolism, this cycle of eating carbohydrates. But what happens when people start to develop diabetes, when they start to develop insulin resistance, they're eating too many carbohydrates, which basically means more carbohydrates than their body can effectively process. So too many carbohydrates for you may be different than too many carbohydrates for somebody else. And when they eat too many carbohydrates, the blood sugar goes too high too often. And when the sugar's too high too often from feeding all these carbohydrates into the system, your pancreas makes too much insulin. And your pancreas is making lots and lots and lots of insulin. And the cells that are supposed to respond to the insulin, they become insulin resistant. And when they become insulin resistant, they don't store away the sugar anymore. That sugar stays in the bloodstream, and when it stays in the bloodstream, you start this whole new cycle of insulin resistance right here. Insulin resistance, the blood sugar stays high, and since it stays high, guess what your pancreas does? It makes more insulin, right? And when it makes even more insulin, then what happens is the insulin resistance gets worse. And as long as you're feeding too many carbohydrates for your body into this cycle, this keeps going and going and going until eventually you develop this disease called type 2 diabetes. To look at some interesting points about this diagram. First of all, I want to point out a type 2 diabetic, they make too much insulin. And the more insulin they make, the worse their insulin resistance gets. In type 1 diabetes is totally different. And in type 1 diabetes, the people don't make enough or they don't make any insulin. Okay? But type 2 is different. People with type 2, and type 2 is the type that affects most of the Latino Hispanic community. And in fact, it affects most of Americans. They make too much insulin. Second of all, feeding carbohydrates into the system by eating too many carbohydrates, that is the proximate cause. That is the root cause of diabetes. It's the carbohydrates in your diet plus your genetics. You can't control your genetics, right? There's nothing you can do about that. The only thing that you can control is the carbohydrates in the diet. Next, the disease itself is insulin resistance. We call it type 2 diabetes. What is it? It's insulin resistance because it's the insulin resistance that allows the sugar to stay too high, and when it stays too high, then it gets worse and worse. And then finally, high blood sugar is a symptom of diabetes. High blood sugar is not the cause of diabetes. If you're going to treat a disease, you want to treat this, insulin resistance. If you're treating the symptom, which is high blood sugar, then you're not really improving the insulin resistance that much, and you're not going to ever get to the cause, feeding carbohydrates into the system. So to recap, the cause of diabetes is going to be a high carbohydrate diet plus your genetics. The only thing you can control is the diet. The disease we call diabetes actually is insulin resistance, and high blood sugar is just a symptom. High blood sugar is not really the cause of diabetes, it's a symptom. And remember that type 2 diabetics make too much insulin, because one of the things we do to treat type 2 diabetics is give them more insulin. That just makes the insulin resistance worse, which makes their diabetes worse. Okay. So how is diabetes diagnosed? It's diagnosed like any other disease. If you go to the doctor with a cough, a sore throat, a little bit of fever, then he'll diagnose you with a cold. A viral infection that's called a cold. And for diabetes, it's diagnosed by the symptom of high blood sugar. Either a fasting sugar over 126, a sugar over 200, either a random sugar or on testing, or hemoglobin A1C greater than 6.5. Hemoglobin A1C just measures how high your sugar is over 3 months, okay? And that's how the diagnosis of diabetes is made. And once you get it, it's a grave diagnosis. It's a very serious diagnosis because, like the ADA website says, it's a progressive and chronic condition. And that sounds like it's going to be a long-term problem, and a problem that you don't have much control over. It sounds like there's nothing that you can do except take your pills. treatment for diabetes is usually initiated with the American Diabetes Association diet, and then they start drugs. And so we'll look at how each of these two things affect the disease diabetes. According to the ADA website, quote, a good place to start is about 45 to 60 grams of carbohydrate per meal. In addition, there are 2 snacks a day that are, quote, most snacks have 10 to 25 grams of carbohydrate. So a good place to start, according to the American Diabetes Association, is about 230 grams of carbohydrate in the diet daily. Well, what does this do to the system? You're feeding in 230 grams of carbohydrate from the ADA diet into this system of insulin resistance, and the insulin resistance just gets worse. Because it's the carbohydrates that are the root cause of this whole cycle of insulin resistance. Well, if the ADA diet doesn't cure diabetes, then surely the drugs do, right? What about the drugs? Most of the drugs are actually aimed at treating the symptom of high blood sugar. There are some exceptions. There is metformin, and there are some of the newer injections which work differently. They're insulin sensitizers. But most of the pills actually make the pancreas to make more insulin. And when the pancreas makes more insulin, the insulin resistance gets worse. And people know that if they've had diabetes for a while, they take 1 pill for a while. But then their sugar's out of control, so they have to take 2. Then their sugar's out of control again a little while later, they have to take 3 pills. And what happens is after we put people on as many pills as we can put them on, their blood sugar's still not under control, we put them on insulin. You know, this is like the last resort for type 2 diabetes, is put them on insulin in a patient whose body already makes too much insulin. And the more insulin we stimulate your pancreas to make, or the more insulin we give you through injections, the worse your insulin resistance gets, which is the worse that your diabetes gets. So the effect of you feeding the carbohydrates of the ADA diet in at the top to keep the system going and keep people insulin resistant. Lots of the drugs cause the pancreas to make more insulin, which worsens insulin resistance. And if you have to resort to injections of insulin, that worsens it too. Basically, this is a formula that is well-intentioned, but will keep people diabetic the rest of their life. Because our treatments in general, our treatments cause the insulin resistance to get worse and cause the diabetes to get worse with time. And this is what happens when you only treat the symptom of high blood sugars. Diabetes can be very progressive. And that's why they say it's a progressive and chronic condition. Because that sort of treatment, your diabetes can progress to diabetic eye disease and blindness, heart disease and heart attack, chronic kidney disease and dialysis, vascular disease and amputations, like amputations of the limbs, and eventually premature disability and death. So I want to ask a couple of questions. Number one, does diabetes have to be progressive and chronic? Or is diabetes actually completely curable and reversible? Let's look at that. The truth is this, the complications are irreversible. Once you've had an amputation, you can't take it back. Once you've had a heart attack, you can't go back to where you've never had a heart attack before. And if you're blind from diabetes, lots of times you can't get your sight back. So the complications are irreversible, but type 2 diabetes itself is reversible. Let's talk about how to do it. And this is the one thing, for those of you who either have diabetes or you have a friend or a family member who has diabetes, this is the one question I want you to take away with you and remember, is that if you had a choice, ask your friends and family members, if you had a choice, would you choose to be diabetic the rest of your life? Or would you choose not to be diabetic the rest of your life? And if they say, well, and that's a good question for you personally, which would you choose? And if they say, I would choose to be diabetic the rest of my life. And if they choose it, then we can use the regular ADA diet and the regular medications that keep people insulin resistant the rest of their life. And they have a lifetime of medications and complications. But if they answer and they say, you know, I would choose not to be diabetic, then they need a different kind of treatment. They need a kind of treatment that would actually cure their diabetes by curing their insulin resistance. And that would be a low carbohydrate diet, like the one I teach at Metabolic Coaching. And then they would be choosing something like a lifetime of health instead of a lifetime of medications, complications, and amputations. And it's just an educational thing. People just need to be educated that this is even an option. At the moment that people are diagnosed with diabetes, their doctor should sit down and say, look, do you want to be diabetic the rest of your life or do you not? Which do you choose? And if they say, I would choose not to be diabetic, then they would say, well, look, this is a dietary change that you need to make, and this is how you can do it. Going back to this is how diabetes forms, starts with eating too many carbohydrates. This is the only thing you feed into the system. So why don't you switch over to a low carbohydrate diet, a very low carbohydrate diet like I teach in the metabolic coaching course. When you switch to a low carbohydrate diet, almost immediately the blood sugar improves. And when the blood sugar improves, your pancreas makes less insulin. It makes less and less and less insulin. And when that happens, the insulin resistance, which is the diabetes right here, it improves. And when the insulin resistance improves, you no longer feed this cycle. Insulin resistance improves, so you no longer have this high blood sugar that always stays high, and that stops. And then a side benefit of the whole thing is that since you're not making as much insulin, you're not storing as much fat, and you lose weight. See, being overweight and being diabetic, those are both two symptoms. Let me say it this way. Being overweight and having high blood sugar are two symptoms of the same disease. The disease is insulin resistance. So by going on a low carbohydrate diet, that cycle is stopped. And that's how you cure diabetes.
Can I ask a question?
Yes, ma'am.
When you're coaching these people who want to change their lifestyles, do they have to start maybe with trying to incorporate a fast, like once a week, or is there anything that kind of science to help reset?
They do not have to fast. However, there's a lot of studies that fasting helps a lot.
That's what I understand.
Yeah. So they don't, because what you do when you go on a low carbohydrate diet, you simulate a fast because you're not feeding any carbohydrates into the system. Your insulin resistance, once you go on a low carbohydrate diet, will be cut in half, okay? Just by the diet. But let's say you're not making progress. You're still taking your insulin pills. You're not losing weight if you want to lose weight. If you go on an alternate day fast, every other day fasting, it cuts the insulin resistance another 50%. So some people it
fasting
does.
Meaning you don't eat for one whole day?
You don't eat for 24 hours.
Okay.
Which would mean I have dinner. I have dinner tonight. I don't eat again until dinner tomorrow. I don't teach people to fast as the first result because most people don't need to, but some people who are severely insulin resistant, they do. And so it's like low carbohydrate diet. Most people do great, but then what if you want to lose 20 pounds? You want to lose 50 pounds. You lose 20 and you get stuck. Or you want to get off your diabetes medications, you get off 2, but you can't get off the 3rd. Then at that point we'll say, well, let's try a fast. Some people fast Mondays, some people fast Monday, Wednesday, Friday. So that is definitely an option. What about this statement that diabetes is a progressive and chronic condition? It's just not true. It can be a progressive and chronic condition, but it doesn't have to be. Because there are a lot of people, even people who've taken my coaching course, have reversed their diabetes on a low carbohydrate diet. Because it normalizes the blood sugar, normalizes their A1C, and normalizes their insulin resistance, and they can get off all their diabetes medications. And so what do you call somebody who has normal blood sugar and is off all their pills? You call them normal. They're not diabetic. They may be at risk to develop diabetes again in the future. They'll always be at risk because of their genes. But they're not diabetic. That's just like saying somebody's at risk for having a heart attack. That doesn't mean that they're having one.
Is it easier to quit smoking or quit carbohydrates?
Carbohydrates is easier. Smoking is harder. The reason is there's no good substitute for smoking. Like I can tell you, if you make a pancake out of wheat flour, it's going to be very high carbohydrate. But you can substitute and make a pancake out of almond flour. It's very low carbohydrate.
What kind of flour?
Almond.
Almond.
It's a nut flour.
Oh my God.
And it makes a wonderful pancake. And so there are good substitutes there that you just don't have for smoking,
Is there any significant difference in terms of the carbohydrates that come from one or more of those type of wheat flour?
That's an excellent question.
Corn flour.
And the answer is I would avoid all wheat, period. Because a slice of white bread has a glycemic index of 71. A slice of heart-healthy, whole grain, whole wheat bread has a glycemic index of 71. Which means white bread and wheat bread raise the blood sugar the same amount. Now, I do eat some corn tortillas occasionally. The only kind of tortilla I have is corn tortilla. I have them occasionally. On my diet, I can have 2 a day. 2 corn tortillas a day. So, what happens when you treat a symptom is that the disease gets worse, okay? If someone walks into the ER with a heart attack causes the symptom of chest pain. They say, "Doc, it's like an elephant sitting on my stomach." And so when that person goes to the ER with a heart attack, would you treat them with the Tylenol because it makes the chest pain better? No, because they're still having a heart attack and they're getting worse. And along the same lines, if somebody comes in with this disease called diabetes, which is actually insulin resistance, they have the symptom of high blood sugar. So should you try and treat their blood, just treat their blood sugar? Just treat the symptom? Sometimes by giving them even more insulin? No. You have to actually, giving them insulin or pills that cause their body to make insulin makes their disease worse, just like your heart attack would get worse. So doing a low-carb diet actually addresses the cause of the disease. The cause by lowering carbohydrates in the diet. It treats the actual disease itself by improving insulin resistance, and that's why the symptom gets better, the blood sugars get better. But what we've done, our paradigm in medicine for decades has been, type 2 diabetics have high blood sugar. How are we going to get it down? And we treat the symptom, which doesn't improve the disease, and we completely ignore the cause. So we're trying to treat the whole paradigm backwards. And that's why people stay diabetic, and it's progressive and chronic. So if I was going to sum it up, if you want to cure diabetes, you just stop feeding the excessive carbohydrates into the system. This is a 3-minute video. I'm not going to play it in the interest of time. But I'll just tell you, you want to watch it or you want me to not play it? Okay, we'll play it.
Or play 2 people.
I recommend everyone can do metabolic coaching. I think that it is a life changer. I was able to get off 9 medications with metabolic
Oh
coaching.
my goodness.
And I lost 40 pounds on the metabolic coaching program.
And I was able to get off of prescription acid reflux medicine and metformin for diabetes.
It's a
I was
diabetes
able
pill.
to get off of all my blood pressure medicine using metabolic coaching.
I went from taking 3 pain pills a day to taking maybe 3 a week, until now when I'm taking maybe 3 or 4 a month.
Over the last year, I lost 44 pounds, and I have felt great, and it has been a great program.
Lost 30 pounds.
I lost 40 pounds.
Cholesterol was 212 and it went down to 136. And the triglycerides was 264 and it went down to 87.
If somebody had told me that my blood sugar would go from 380 to 107 in a week, I would have said, you are crazy. That will not happen. But it did.
About 2 weeks, I saw my numbers going from,
Blood sugar.
200 down to 100.
The joint pain was really bad, and within 10 days' time, that was probably 90% better.
And immediately, within 2 weeks, I felt like a completely different person. My husband of 20 years said it was the old Amy that he knew.
The main thing I noticed within 3 or 4 days was that the pain I was having in my hands from carpal tunnel syndrome pains and symptoms was gone.
So we'll stop the video there. But basically, blood sugar from 380 to 107 in a week. That's by stopping the feeding of the carbohydrates into the cycle. And that lady whose sugar went down that much, she had just been prescribed her 4th diabetes medication, and now she takes 1.5 of what she was taking before. The other lady whose sugars went from 200 to 100, she got off her metformin, she had her hemoglobin A1C, had her sugar checked. She's just normal, a normal person, not diabetic. So to recap, 11% of the Latino Hispanic community are diabetic and 4.3% are pre-diabetic, which means about 15% of the population has diabetes or pre-diabetes, and that's over 1.4 million people in the state of Texas, in the Latino Hispanic community. That doesn't include the 2/3 who are overweight and obese, because overweight and obesity is another sign of insulin resistance. So if you know a diabetic, if you're diabetic yourself, if you have a diabetic family member, educate them. Educate them that diabetes actually is curable and it's reversible. It's not something that they have to treat their whole life. It's not something they have to take medications for their whole life if they'll change their diet. And after you educate them, just ask them the question, if you had a choice, would you choose to be diabetic the rest of your life, or would you choose to not be diabetic? And if they say, you know, I would choose not to be diabetic, which about 95% of people would say, then refer them. Send them for metabolic coaching, and we'll teach them how to do a low carbohydrate diet so they can get off their pills. And the future of the health of the Latino Hispanic community, it really depends on you. You know, it depends on you and you and you and you and you individually. Because the doctors aren't going to do it. The doctors don't have time because their clinic's too busy. You know, it's 7 minutes per patient, as fast as they can go. They're overworked. The medications aren't going to do it because a lot of the medications make diabetes worse because they make insulin resistance worse. And so if somebody's going to make a difference, it's going to have to be you. And the good thing would be to start with, you know, one person. If you can get one person and change their life, then you get 2, then 4, then 8, and you start a snowball rolling. And then hopefully the snowball will turn into an avalanche and make a big impact on the community. So if you know somebody and they say, I would choose not to be diabetic, refer to them and we'll see what kind of difference we can make together and see if we can end this epidemic of diabetes in the Latino Hispanic community. Thank you.